thank you again for joining. It's a little after 8 p.m. here in beautiful Tucson, Arizona. And I know for you, you're already I think most of you at least are on the next day and during the day. So thanks so much for making time to join the webinar. So let me just begin with giving a quick background on the Global Center for Healthy Workplaces. So we have been around for probably 7 years now. We started out our main kind of flagship event as the Global Awards Summit and the Global Healthy Workplace Awards. And the certification came out of the awards as there was interest in getting recognized and meeting certain criteria to become a healthy workplace. And every year we have a summit in a different country. This year we were in Italy, in Bergamo. Next year we'll be in Melbourne, Australia. And so everything we do is as you will notice throughout the presentation, is very global. You know, that's very important to us. As you know, there are some other events, initiatives, organizations say global, and they may only have a few people come in from outside of the home country. So anyway, that's very important. And I think over the years we have received some great applications from all over the place, all continents. And the quality is very high. I'm very glad to see those. It's really a testament, I think, to the field, to the growth of the field that we've seen. You know, I've been in the field for over 20 years, and it's just magnificent. You know, I spent most of my time professionally in the United States, but I am from Germany and have an office there too. So I spent a lot of time still in my native country, and you know, in both of those countries, it's just been great. But again, looking at it globally, you know, you go to Asia, where some of you are located. It's a lot of growth, fast growth, rapid growth, as in many other areas, just like the economy. And I see that with workplace health or healthy workplaces. So that's exciting. Having said that, I still think we have a lot to do, right? There's a lot of work to do. The programs are often fragmented, not comprehensive, not evaluated. Not part of the organizational structure of the business. And with that, often they come and go, and they're just looked at as a nice to have, as a benefit. So this, you know, having said there's a lot of growth, this is the other side of the coin, or the medal, if you will, that a lot of programs are really don't kind of meet the criteria, at least not those that we are talking about today. So again, I'm very glad you are part of this webinar, and I look forward to further highlighting the certification. So I think by now you should be able to see the healthy workplaces, the global model for action. And this is from the World Health Organization, as you can see in the bottom. And I was fortunate enough to be part of the global working group developing this model some 7-8 years ago. And I still think it's very relevant up to this date, even fast moving times. And it's universally relevant, which is so important from a global scale. So before I start going into the model, and I hope you have seen this before, I just wanted to say that the World Health Organization does not endorse in any way our awards program, and that's just part of the WHO for a good reason. They're not going to recognize or endorse any kind of organization, whether private or public, in terms of having a healthy workplace. So, but nevertheless, it's technically very sound. As you can imagine, the WHO, that's their strength, putting together very good, solid, technically sound resource documents and guidance documents. So we have 4 main areas in this model, and I'll mention some examples in several slides, but I'll just go over this fairly quickly with this slide right now. So the physical work environment, which really is mostly about occupational health and safety. The psychosocial work environment, which is a lot about the work structure, the work organization, and how leadership is structured. Very important these days, I think, especially in terms of mental well-being. The third area we have is personal health resources. So this is a lot about your personal wellness, your well-being, whether it's, you know, the physical activity, the smoking cessation, the nutrition, all those things pretty much fall in that area. And then you have the enterprise community involvement. And this is a term the WHO coined, and it largely represents CSR, corporate social responsibility. It's not exactly the same, but it's pretty much similar to it. What does the enterprise do in terms of health in the community? How do they interact? Are they making sure they're not, at a minimum, not destroying, the community? You can start with the environment, obviously, but many other areas with regard to health, and I'll delve into them a little bit later as well. In the center, the blue squares that you see, you're probably all very well familiar with that. This is a continuous improvement model or cycle, which I think we've all, at minimum, learned and hopefully practiced in our work today in terms of mobilizing, assembling, assessing, planning, doing, and evaluating. I won't go into every single one at this point. And then at the very center, you have the ethics and values. So that's very important, I think. Ethics, of course, some people think you don't have to mention it. I think we do at all times, how important it is to exercise good business ethics, good professional ethics, and with regard, to health. And for those physicians of you obviously know this very well. Do no harm. And I think that's, you can even equate those at the same degree at the workplace. You definitely want to not do harm, but you want to do more, and that's what we're going to be talking about. And then, of course, leadership engagement is key, and at the same time, worker involvement. We very often focus on leaders and say we need good leadership, we need to get leadership involved, we need to convince them. All those things are true. If we don't have your senior leadership, or any leader, if you will, convinced that this is a good thing, the program won't last very long. It's very likely. But at the same time, the same thing applies to worker involvement. So if your employees are not fully vested, fully behind your workplace health promotion program, again, it won't succeed, at least not for too long. So they need to get involved, and they need to be made an active part of it from the get-go, from the beginning. So that's very important. So I will now go into each of these areas just to get a little bit better idea. And some of you will think some of the areas are very well known to you. You maybe even exercise or practice this on a daily basis, and other areas maybe not so much. So it'll be interesting to hear your reaction on that one. So the first one, as you can see, a physical work environment. A picture speaks 1,000 words, right? I could have had a long list here with policies and management systems and occupational and all those good things, but I think this is pretty clear. And a lot of jobs, unfortunately, are still structured this way. I mean, we keep talking about service industry, your office desks, the lack of activity, sitting, which is very true. That's the direction I think the working world is going. However, I don't know the numbers off the top of my head, but millions and millions, and I think especially in some of your countries, this is very common. Manufacturing, hard work, manual labor, that is very common. And I think we need to take care of that. And as you can see here, we could analyze this and talk about it for hours, if you will, in terms of the posture, the safety or lack of safety, as you can see here. The lighting, how is the lighting? The temperature, we can't tell, but, it's probably hot. The personal equipment, the dust coming out of it, we all know what that does, and then lifting the weights eventually. So, all hazards, and with that, risk factors, which we need to either eliminate or, as manage as best possible and minimize. So, that's very important. Every application to the certification needs to address this. Sometimes, let's say it's a bank or a professional services company. They apply, and they may not have that as their priority, which compared to a manufacturing facility is understandable. But at the same time, even the office places, the office settings, they need to have policies in place. Even with ergonomics, as that can be a risk factor in itself. So I'm just saying that with the applications, you need to cover all of these areas. It's very important I will be emphasizing this a number of times over the next half hour or so. I already kind of alluded on ergonomics. So I think you probably have seen a schematic or picture, if you will, like this one. And again, we could analyze this one very closely and kind of look at research if any of this has changed. This is a little bit dated, but I think a lot of that still applies. A lot has been talked about. I won't go into detail here. but a lot has been talked about the sitting posture, right? And some of you, again, may be very well in deep to this and have ideas about it. Standing desks, walking desks. I mean, these things are being experimented with, and I think we need more research on how effective they can really be. Aside from the cost, obviously, that's a whole other issue. Sitting on a ball, all those things, exercise ball. So it's not just the chair anymore, right? But it's very important that we need to address the ergonomics and make a good assessment before you start working and throughout your work for each employee. So that's just another example. One is more manufacturing. This is more of an office setting. Moving on. This area, psychosocial work environment, one of the areas of the WHO model, is often misunderstood or not understood well enough. So it's good to spend some time on this one as well. And I would say if we, over the last 6 years of applications to both the awards program and the certification, we of course the applications vary, right? But I think overall, kind of generalizing, psychosocial is really kind of still a weakness, I would say. So these are some of the hazards. So if you're coming from an occupational health background, you know this terminology very well. So we're just applying the same kind of risk management system to the psychosocial work environment compared to the physical work environment. So here are some hazards. So lack of variety or underuse of skills, like a high uncertainty about your work, or even job insecurity. You don't know if you're going to have your job tomorrow or next year or next month. That's often the case in fast-moving economies. Overload or underload, even high levels of time pressure. Most often, what we hear, I think, is overload in these times, more to do and less time. But some people in their positions are underloaded, and that's also a hazard. They don't feel happy and may be unsatisfied, and at some point develop disease. It could be. We all know, I think, the challenges of shift working. So I won't get into that, but there's a lot being researched on shift working and different schedules, and so an inflexible work schedule, even aside from shift working, is a risk, or rather is a hazard. And as you will know, flex work is becoming very popular, or more and more used. Low participation in decision making, lack of control over your workload. And again, there's a lot of research on this, kind of the balance of your demands placed on you and how much control you have over your workload. There's the Karasek model, which you may know there. So that there's really is very interesting. If you haven't looked at it, I highly recommend you to look at that kind of research. Because it really is impressive in terms of the body of research that it can actually develop disease if those two don't balance the right way, demands and control. Poor environmental conditions, there's lack of space. I think that's self-understood. Poor communication, low levels of support for problem solving. I think we can probably or have probably been in that situation sooner or some point in our life, in a professional life, I think, and that doesn't feel good, right? If your communication is not good within your team or your company in general, people don't feel well. I mean, they're insecure and they're not sure what to expect, and especially if you have that job insecurity on top of it. Isolation, whether social or physical, is a hazard. And then conflict, of course, interpersonal conflict, whether it's with your coworker or even your boss. Then kind of even worse, bullying or harassment at work. That's been highlighted in many ways, especially the larger companies have policies in place around this issue, not just sexual harassment, but in general, bullying and harassment. It's a problem. It really is. It's a challenge for a lot of companies in different countries. So it needs to be addressed. You're having ambiguity or even conflict in your role. You're not sure really what to do, or it kind of heads or bounces against another role. Having that conflict again. That's not a good situation to be in either. I mentioned the job insecurity. Also, poor pay is an issue for many. it's not necessarily the first thing. I think you may have seen some of these surveys, rather, where what kind of really drives you, or the most important thing in terms of finding a new employer or your job in general. And pay usually is not the number one, but of course it does play a role, especially if it's poor, especially if you're underpaid. It's gonna be a major burden on you, and then on your health. And then finally, the work-life balance is a very common term. So having conflicting demands, just not having enough time for some of your home life, especially you have to care for children or the elderly. So I could go on for this for many hours, but we need to move on. I think it's a very interesting area, and needs to be focused on more, I think, by most companies. So, oh yeah, this is just a very interesting side note, that in Europe, and I don't think we have anybody from Europe at this hour, because it's pretty much in the middle of the night right now. That is the psychosocial risk management, or assessment and management, is part of the European legislation, the Framework Directive, back from 1989. So companies in Europe have to address it. I mean, again, each European Union state has a different legislation, I would say. So because the European Union provides directives, and the actual legislation comes from the nations, from the nation states. So it's not always the same depending where you are, but it does exist, and countries are supposed to and have to pick this up in their national legislation. So I just wanted to mention that it's not just a good thing to do; it's actually a must thing in definitely in Europe, and a few other countries too, as far as I know. Moving on to the personal health and well-being area. So I think I just thought I'd bring up this, I guess, triangle. You may have there's many, I think, models, well-being models these days. This is from the Human Performance Institute, belonging to J&J. I think I just wanted to throw up an image rather than, again, having a long list. And it shows that it's not just about your physical health, your physical well-being, right? That was a thing, which, an issue, a focus, I should say, for a long time, and still is very necessary. But now we're looking at a broader model. That's my point. We're looking at a broader well-being model. We all know of the important, significant impact of mental well-being, emotional well-being, and now also spiritual well-being, purpose in life. There's again a lot of research being done on this, and some companies are really focusing on this and trying to link their health and wellness programs to a purpose, to the life purpose of each employee, to make that, especially the Human Performance Institute with their program does that, but others do too. You probably know the Gallup Wellbeing Index. It's another very well known index, and there's a few others out there. So I don't want to go into too much detail here, but going back to the certification and the application, the employer needs to show how are they addressing these areas. Are they offering opportunities to be physically active? Are they promoting healthy nutrition in their cafeteria, or educational, of course? Are they providing opportunities for mental well-being or emotional well-being? Whether it's accessing online services, counseling, all these things, which are supposed to help your personal health and your personal well-being, and mentally too. So I'll leave it at that with this area, because again, that's another area which is pretty big and can be talked about. And some applications are very strong in this area. They've done a lot of wellness, well-being work and programs for many, many years. But they don't focus on the other areas too much. So that's, again, I'm trying to bring it back to you should mention each area and how you address those. Of course, you will have some strengths and weaknesses. That's normal. But how are you addressing your weakness? And maybe you have a plan to address those. And maybe you're not. You maybe haven't addressed the psychosocial risks yet as much. But ignoring them is, that's not an option. I think it's just a matter of how, what's your plan, and what do you have in place. So moving on, the enterprise community involvement. So it's really about CSR, as I said, social responsibilities, activities that you do, organized by the employer, your expertise or any other resources the enterprise has, and shares or provides to the community, to the actual physical or social community. And just an obvious one is screenings, opening up your health screenings that you do for your employees to families, maybe, and the wider community. That's just, I'm not saying you need to do that, but I'm just saying that's one area where companies have really succeeded in terms of this area, the enterprise community involvement. So provide it to the immediate local environment, but also the broader global environment. I think that's important too. It could be expertise. It could be sharing about how you make your workplace healthy with other companies, with smaller companies, which may not have the resources to do so, but need some help. That's another example, I think, which is important. And I do want to say that there should be a link to obviously to health, because we're talking about health and safety. So some companies they do a lot of good CSR stuff, but it's very separate. It's just, very fragmented, separate. Doesn't really link to the health and well-being program. So that making that link is very powerful, I think, and needs to be made, rather than having something, a bit, the kind of stereotypical building a well in Africa, which again that's important, but there needs to be a link to the strategy in the program. And most, I should say, a lot of companies, I don't know about most, but have some really good programs, and we've been really impressed with some of the examples that they provide. And they're not all just big ones, the ones that you hear in the news. A lot of smaller ones have some really innovative programs around this as well. So let's move to the kind of the 5 keys. So I touched upon those earlier, and I'll bring them up again because I think they're really important. So leadership, commitment, and engagement. I think it's highly significant to get your leadership involved, and not just involved, but supporting, but also actively involved, rather than just signing a document or signing the budget, which is important naturally, but having them be leaders in this program as well, having them out there visible, and that, I think that can go a very long way. And if they participate in the program, they're much more likely to support it in an economic downturn as well. So you need to get them engaged. You need to be kind of creative about it, and get them engaged, and keep on doing it, not just one time at the beginning, but keep them engaged. And obviously, the reporting plays a huge role in terms of the success of your program. Worker involvement, I brought that up, very important. So on the one hand, you have your employee representative groups, and again, that's to a degree cultural in some countries, like in Europe, very strong, unions, worker representatives, works councils, and those things. So that it really depends. There's different ways to do it, obviously, and but the workers, beyond their representative groups, they need to be involved. So the individual workers, and it's not just a feedback survey, which we often hear. Important as it is, there's more to it, more to worker involvement than just getting the feedback and what do you want, what are your interests. So actually having them actively involved in the planning process, in the implementation process, is powerful. And I think we've seen a lot of interesting movement around this area with champions or volunteers, if you will. A lot of companies use these. They're not health people, but they can play a big role within the company. So that's a good one. Ethics and legality, I think, again, self-understood. Nevertheless, we know that a lot of companies do not follow necessarily all laws and are not ethical. So that's part of the certification application. You will see that. You need to kind of make a statement about it and show it. That you are bound to ethics and are complying with legislation and workers' rights and all those things, social code, and so I think that's important. Needs to be emphasized at all times. Sustainability and integration. Sometimes the word sustainability, as it's so popular these days, gets confused. We explain it in the application survey. But I just want to make the point that it's more about program sustainability. So rather than having a one-off, next year it's gone, that it's sustainable over years, that it's part of the business, just like your marketing strategy is. So so how do you make sure that the program is sustainable? That's an important one. And then integration. So you saw the various areas of the WHO model. That's important to focus on, because the typical. Let me give you an example. The typical one is health, and well, let's say health promotion, wellness, and on the other hand, safety, occupational health and safety. So very often these two areas are still, unfortunately, work in silos, and they don't work together. They're not integrated. The people don't sit at the same table, or maybe only once a year, but they don't work together necessarily. Another one is HR. HR, it does their own thing, and then you have health, safety, and environment, HSE, on this side, and they don't talk to each other enough. That's a big problem. They need to be integrated, and it's a reflection of the model, and the circles overlap. So the program will be more powerful if you have standardized branding, also a branding, a standardized communication, terminology, all these things. That if you're integrated, it's much more powerful. And then finally, the continuous improvement cycle, which I briefly went over. And let me just give you an example. So the Global Wellbeing Survey from Buck Consultants, or from Buck, as some of you may know, I'm not sure if you participated. Over the years, we've seen that the companies were asked, do you measure specific outcomes of your program or programs? And the number is low. The number is below 50%. Now, given that the companies participating in the survey are probably some more of the more advanced ones, right? There's probably a selection bias here, because it's a survey, as you can imagine. And that number is always striking to me, because less than half evaluate or measure, and you wonder, well, that's so important, right? How do you know how successful your program is if you do not measure, if you don't show those outcomes, or even just try to track it from a periodical on a periodical basis? So that's always very, very striking, and I think it shows we have a lot of, again, work to do and educate. And we always ask about the barriers in that area, and very often the answer is, well, we don't know, it's too costly, or even don't have time. That's time, as you can imagine, often gets used as a maybe an excuse, but as a reason for many things. But so I think there's a big educational need there, because evaluation does not need to be costly. There's different ways to evaluate, and don't know. Obviously, that's a need for training right there. So I just wanted to emphasize that, because I think that's a big gap. And there may be other gaps in the continuous improvement cycle, but the evaluation piece is not necessarily very strong, I see. So let me just say one more thing. Let me go back on the slide on the evaluation, kind of linking it to the application. I will talk a little bit more about the application in a little bit. So basically, some companies have young programs, right? And I often get this question: well, should we even bother applying? And there's no straightforward answer for that, but it depends, right? But a company with an ambitious plan, covering the areas, following the continuous improvement cycle, but they may not have the results yet they want, I would probably encourage them to apply, because as you know, there's different ways or different forms of evaluation. It's not always about having the health outcomes, which are difficult to achieve. As you probably know very well, changing behavior, changing health habits is very difficult. Takes time and is difficult, and the environment needs to be right. So that's, I think, in terms of the evaluation, there's other ways to show progress, starting with participation, with satisfaction, then maybe some questions or tracking on health habits or knowledge. There's different ways to look at that. I think rather than just having very kind of clinical outcomes, or even ROI, the return on investment, which is very difficult, I think, to show. It doesn't need to be an ROI. We don't ask for an ROI in this application. It's actually there's a number of different indicators listed as examples, but we don't ask for specific indicators, like, for example, required, if you know what I mean. So we don't ask, show me if you were able to reduce sick leave, show me that you were able to improve productivity, show me that you were able to reduce health risks. We don't ask it that way. We ask, how have you evaluated the health, or not the health, how have you evaluated your programs or the impact of your program, process and impact of your program. And then we list a number of examples, and then there's another category. So as you know, not every company has the same goal. And some companies don't even track sick leave anymore. So as you can imagine, they won't have that number. So and some systems, you don't even know what the reasons are for your sick leave. So just wanted to make that point in terms of evaluation. So I'll go into the benefits and then a little bit about the process of the application, and then I know I've already seen a question here coming up. I'll address some of your questions. So the benefits, really, I mean, I think maybe the most important one. Obviously, the recognition part is one important, which comes up here later. But I think just having the analysis being done and getting feedback on your program and benchmarking it to a standard of global excellence is pretty powerful, because you don't always have that opportunity to do or to get done. So that's I think really one of the first ones. I think that recruitment, retention, ability to demonstrate sound ethical business principles, performance, and value to stakeholders. We've done some really interesting work, not to get sidetracked here, but with investors, and we see that the healthy workplace with varying criteria, definitely safety, as you know, is becoming more of a topic of interest for investors in terms of their actual rating and analysis. So that's gonna come more and more, and we're already seeing it. And I think it's still in its infancy, but just imagine if investors in your company start asking you, well, what are you doing for the health of your employees? And then if you don't do anything, well, I don't want to be in the same room in that situation. So I think that's going to come more and more. But obviously, there's other areas and forum, just even employees in terms of recruitment, they ask about these things these days as well. So very important. So you will, if you get certified, you will receive a certified employers promotion pack, which comprises of the five or six listed items here in terms of the branding, obviously. And then what we do, and this is really, I should have mentioned that right at the beginning, this is really part of our mission with the Global Center. Like, we are really very interested, or I should say very keen on sharing good practices globally, and sharing them in a user-friendly way, and so other companies can learn from it. So rather than having an awards program with the photo and then people go home, or a certification with a logo and they just keep it on their letterhead and so on, which is important, but we are very keen on making that program known, and working with the certified companies, giving them a chance to share their program, whether it's through our newsletters, whether it's through our social media. We do a lot of work on social media, press releases as well. All these things can be very valuable, I think. And on the one, it's visibility, it's promotion. On the other hand, it's really about sharing and learning, enhanced learning for a lot of other companies globally. And hopefully those two things go hand in hand, that the one side benefits from sharing it and the other side benefits from learning about it. So I think that's important. You will see that a lot, I think, in our communications, if you haven't already seen it. Also, we invite our certified employers to our annual awards summit. We recognize them on stage because we believe that's important. Because as you know, a lot of this, or most of this, happens virtually. But we know how important it is to meet each other. Meeting other employers, other certified employers, I think is valuable. being recognized in a physical way rather than just virtual. I think that's important to mention at the same time. We do annual knowledge sharing webinars. We do some research programs we'll be glad to share. Not today because we don't have the time for it, but that may be of interest to some of you. And so I think those are the most important things. And there's an automatic entry for the Healthy Workplace Awards as well. And just quickly, I don't want to get into the awards too much because that's not the focus today, but that is a competitive program, meaning that our judges basically score each entry, and there's only one winner and one runner-up. Same criteria, but the certification is a threshold. You meet the criteria, or you don't. And with the Healthy Workplace Awards, it kind of gets more competitive in that sense. So I did want to mention, so we're about 40 past the hour, and I see some questions coming up. So I did want to mention our partners. So we have worked with a number of partners globally because we think it's important. We don't want to compete with any national programs. Key is really that these organizations that you see here apply the same or similar, very similar criteria. So none of these have a totally different philosophy or different criteria than the WHO model has. Otherwise, we wouldn't be working with them. I just wanted to emphasize that. So we have varying agreements with these companies, or with these organizations, I should say. Some we have a very straight up partnership that their companies who get recognized in a certain category. Some have the gold, silver, or platinum categories. That their top category gets the global award, or global certification. Excuse me. So that's important to if you know any of these and they're in your own country, I highly recommend, if you probably already know them, to go through them and find out what they're doing. I think that's important to mention. And we keep growing. I think there's more and more countries now which have national recognition programs. And again, as long as they're close enough to the criteria of the Healthy Workplace Framework, we would like to work with them. And with many we already do. So that's exciting. Here are some of our certified employers. Again, you see a variety of different countries represented. Most of these are larger companies, but we have a number of smaller ones now as well. In Pakistan, for example. So that's always good to see a growing number of smaller companies. We had a few from Italy, which are not featured here in photos, which are medium-sized employers. So that's very encouraging to see as well. And at the same time, of course, some of the larger names are great to have on board, especially if they already have other awards, Great Place to Work or CSR award, all those things, right? So it's very encouraging to see those and buying into the Healthy Workplace Framework in a serious way. So my last slide, before I get it to the questions, I wanted to say a few things about the process. So first of all, again, I think I mentioned this before, but it's all virtual in a sense. There won't be any on-site audits. As nice or as effective as on-site audits can be, and you all know them from safety audits, it's just not a practical or realistic exercise at this point to do that on a global scale. Having said that, we do have some of our partners like World in India do on-site audits. So if they already do it, and we have that partnership with them, they may actually be included. So, but in general, that's not required. But we do ask for, if you will go through the application, we do ask for documentation and proof, so to say, accountability around certain things. And some companies do it very well, and they have all kinds of documentation, and it gets hard to go through all these documents, but they do a good job with it, and others maybe have lacking it here and there. So that rather than just checking the box, right? You need to kind of show in not every single question, but in the main ones, we do ask for it. Like just one obvious one or example is, do you have a health and well-being or a healthy workplace charter or a statement, company statement, and where is it? Show it to us, please, or maybe even a policy around that. and most companies do, at least at this level. So that's good to see. You see our different price ranges here in terms of the company size, so making it affordable for smaller employers. I think that's important to point out. We do have the option of a refund if you're not successful. Now, having said that, we of course are very interested in having every company succeed that applies. We're not going to sacrifice or mitigate or the criteria. Obviously, I mean they're upheld in a very serious way, but we kind of work with the companies up front to give them a good idea. Again, the webinar is just one element of this, to give them a good idea of what it takes and how good are your chances. So, but of course, we do not know. We don't know the company, and we can't, we can't give a guarantee, or you can't say, oh, you're definitely going to get certified. So there is this option, that in terms of if it doesn't work out, but you have applied, put the work in, there's a 50% refund, and there's a chance to reapply again after 6 months. It's a 2-year duration that the certification is granted for. It can be renewed, of course, and all our procedures, our criteria, and the process and all the procedures, they are reviewed by our judges. And I maybe I should have had a photo of our judges. We have 5 different judges from 5 different continents, all very well-respected individuals in the field, who judge our awards applications, and they take a look at our certification process as well, and that's very important. So we again, we're big on quality control, and that needs to be upheld at all times. And I should say, maybe I haven't mentioned this yet, that the certifications, they are basically granted to organizations within one country. I'm mentioning this because we do get a lot of interest from multinational companies, and you may have seen some of the names just now. But they are all applying with a local or a national branch or site, if you will, because for us, again, in terms of quality and accountability, I think it's very difficult to ensure from a multinational enterprise that all the programs, that the standards are upheld across the globe, especially with a company with maybe in 150 or 100 countries. Just imagine the effort that would go into that. So maybe in the future that's possible, but I think that would be very ambitious to do, to check every single country if they have it in place. So I think hopefully I covered most of it, and